Greetings, everyone. This is Eric Laser, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. Bright Spots Ventures is dedicated to accelerating innovation through content, communities, and meaningful connections. Our mission is quite simple: to spotlight what's working in the industry and help scale it. We bring together leaders from health plans, hospitals and health systems, and other healthcare organizations across the land to share proven strategies that drive measurable impact. Through our podcast and webinar series, our private executive councils, our dinner meetings, our go-to-market strategy work, we try to surface and amplify the bright spots in our industry, proven innovations that others can learn from and hopefully replicate, because at our core, we exist to foster trusted relationships that fuel real progress in healthcare, because we believe the best way to improve the industry is to find out what's working, those bright spots, and clone it. If you have not subscribed to this pretty useful and pragmatic podcast, if I must say, 12 plus years doing it, stop what you're doing right now. Go to the podcast app you like most, type in Bright Spots in Healthcare, and please subscribe. You have a lot of great experts that we're privileged to meet and interview each and every week that share incredible ideas that could help you do your job easier and improve healthcare for all of us. And with that in mind, we are privileged to have an incredible group of experts in front of you today. I first want to do a shout out to our sponsor for today's episode. We love them, Acario. They're the leading health action platform, helping health plans turn member insights into meaningful actions that improve outcomes, satisfaction, and improve your stars performance. You could check them out at acariohealth.com. That is ICARIO health.com. We'll put the link right into the chat and in the show notes if you're listening on the podcast. And we'd like to introduce, representing Acario Health, their head of product, Jake Petrilia. Jake, I was practicing that last name like all night, so I hope I nailed it. And along with his peers on the panel, Dr. Sarah Moyer, the Chief Medical Officer at Healthy Horizons in Kentucky, a Humana company, and Sherry Zink, the Senior Vice President, Chief Data and Engagement Officer at Blue Cross Blue Shield of Tennessee. Thank you all for being here. Our topic: missed data, missed dollars, and the member insights that risk models are blind to. So when we're thinking about member HRAs and how they capture more than just clinical facts, they actually reveal behavioral and social signals that can guide better engagement, retention, and outcomes. And we're going to talk about that and how to best leverage that, because plans and providers, when we continue to work, right? You're all continuing to work to gain better insights into factors like loneliness and mistrust and low activation. And understanding this a lot better can result in understanding where the early churn is going to be, where your early churn risk is going to be. It's going to allow you to drive better, more individualized personal outreach, and in general, shape more scalable strategies that improve CAHPS, close gaps, and boost overall satisfaction and help make your business more sustainable, particularly in 2025-26, where so many things are changing around government reimbursement. So we're going to explore today the three key areas. We've divided this show into three segments today: enhancing real-world member engagement by acting on these insights. Then we're going to talk about aligning outreach with behavioral motivators to improve CAHPS and overall satisfaction. And then we're going to talk about hidden data and how to turn that into measurable stars and quality gains. So a lot to cover. If you'd like to co-moderate with me, we have a Q&A module, which I'm sure you're very familiar with if you're watching live on Zoom. Feel free to type in questions in that Q&A module. My team and I will be taking a close eye on that, keeping a close eye on that, and we'll try to integrate your questions. And please don't use the chat, though. You could use the chat to communicate with the people watching today, but for questions to our panel, put it into Q&A module. Really appreciate that. All right, here we go. Oh, final thing, because I'm going to get yelled at. At 45 minutes past the hour, as usual, for our live attendees, we're going to ask you for feedback on what topics we need to cover and how we did today. And we ask you thank you in advance for taking 2 or 3 minutes to provide that feedback. And anyone that does that will get a version of my notes that I take during the show, which I guarantee you are better than AI notes. So You'll get that if you just take 2 or 3 minutes to complete the survey via SurveyMonkey at the end of the day today. So Sherry, let's start with you, because engagement starts with data and knowing your members, right? So you're in charge of data and engagement. How is Blue Cross Blue Shield of Tennessee using multiple data sources to truly know your members and turn that into action?
Yeah, thanks, Eric. One of the things that I think is really important is understanding information about the member and where they need help is extremely important. And claims don't always tell us that information. And the provider-patient relationship is really important. And the provider may also have additional information when working with that member that may be important for us to know as a health plan as we help that member navigate that healthcare journey. So not only do we look at claims information, but we're also working with the provider to get information from maybe a clinical record that may be important for us to know as we're working with that member. The other thing that's really important is understanding how the member feels about their treatment, how the member is seeing their ability to engage and interact with both the physician and the health plan. And so the way that we do that is there's a lot of different ways. One is we have health risk assessments that we allow our members to fill out as they come in and work with us. We also have certain health assessments that we leverage when we think about working with a member, like let's say that has diabetes or cardiovascular disease, that really helps us gain a lot more insight about how the member is feeling as we assess those survey and assessment results. The other thing that's really important when we think about whole person member engagement and care management is really looking at those social risk factors that may play into a person's ability to be able to get the right health care for themselves and to work on their quality of life. And some of those may be things like food insecurity. Do they have access to the right food? The second one may be transportation issues. There could be language barriers. So really understanding all of those various components of that information are really important to understand the best way to help a member get better or address a disease state or really close a gap in care associated with that member. So we use all of that different kind of data to help us personalize that engagement with the member and remove those barriers to care that they may have as they're trying to navigate the healthcare system.
So how do you, it sounds like, so you guys are pretty extensive with the types of tools you send out to members to collect data beyond just the HRA. How do you triage those or use those in a way where you don't over-survey people?
Yeah, that's really important. So we have different ways that we do that. So sometimes we may work with an employer group because they may want to launch a health risk assessment when people are signing up for benefits, and we may leverage that information. When a person is identified to participate maybe in a clinical management program that we have, they may be working with a care manager to fill out additional health assessment information. And then we have different types of campaigns and things like that that we may launch that are on a different cadence. So tracking all of that information and having those prioritization cues in place are really important so that we don't bombard the member with too much information, but really the most important information for us to help them navigate their healthcare journey.
Right. Thank you for that. I'm going to move over to Dr. Moyer. Sarah is the Chief Medical Officer again at Healthy Horizons in Kentucky, a Humana company. And Sarah, what's Humana's playbook for building trust, and how do you sort of adopt what you're doing to ensure that you're meeting each member's needs?
Yeah, so engagement really vital to the success of the plan, especially as you mentioned, as we work to improve the quality of the care that our members are getting, as well as build trust in the healthcare system. So our company's core values being caring, curious, and committed, and that's really the core of the engagement strategy that our teams have. Really try to focus on the empathy and that trust building. Our quality teams tend to not have a rigid script. And so one team just wanted to dive into a little bit today is that our quality compliance professionals. We call them our all-stars, and they really go above and beyond. And that's because in Kentucky, 2% of our revenue is withheld, and we can earn that back by improving 3% on 6 core measures: hemoglobin A1C, well-child visits, childhood immunizations, adolescent immunizations, postpartum care, and then social needs screening and intervention. So these quality professionals make 25 plus calls a day, but maybe only get 4 families like on the phone to have that impact. And so really that comes down to like those first 2 sentences of interaction to get that impact. And so before they make calls, they use all the data mentioned previously, like looking at HRA data, looking at prior calls to the plan and what they are concerned about, what's going on in their life. And they use that to really meet the members where they are, to build that trust and connection quickly from the start.
So I just want to make sure we capture
Yeah.
right. So I heard the All Stars, one of their big KPIs is to earn that 2% withholds from the state back. And then just to make sure we all understand the requirements, you listed about 5 requirements, and you don't have to relist them, but you said you have to have a 3% improvement on all 5. Is that the criteria?
Yeah.
Okay.
5 out of 6. You have to improve 5 out of 6.
So you have to improve 3% or more on 5 out of the 6?
To make it to the bonus pool, you have to improve on all of them to earn all the money back. But yes.
I got it. Okay.
Confusing.
Well, I mean, a little bit, but not really, and it certainly provides some motivation on why you're hiring these all-stars to make the calls and sort of give the white glove approach, so to speak.
Yeah. So like really just focusing on whatever that member might need. And so if a member's in a bad mood, it might just be listening that first time, and then calling back at another time that helps for them. And so really that human to human approach helps us build that trust and then move the needle on improving care and closing those gaps.
So in preparing for this episode, it was there's this underlying kind of theme that we're not taking advantage or leveraging the tried and true HRA as much as we can. And so I want to bring in Jake Petralia. He runs all the product for Cario. And Jake, when you look at the HRA and the risk data, what is the key to using it in the moment to engage members more effectively?
Yeah, it's a good question, and it's a fun problem that we're trying to solve at Acario. And first thing is that it's exciting to meet health plans that are actually using HRA data downstream for their clinical decision making, right? And that's not the case for everyone that we work with. Some are just more of a check the box activity. But specific to your question, what we use as the phrase is moment of influence, and I will say that is coined from my time at Humana, Sarah, but it's very relevant in this case, which is for health plans that want to make sure that they're using the HRA data downstream, what it is dependent upon is the member actually completing the right questions, right? And not just filling out the ones that are easy. So in the moment of influence in this case, what we've learned from the retail space is like think about if you go to a website to buy some clothes or something, you put everything in your shopping cart and you abandon it. You really have 24 to 48 hours to get that person back in to make with a higher likelihood of completing the purchase. We treat the HRA as no different. You have 24 to 48 hours to get them back to see if they can actually complete the survey, right? So we're working with health plans to say, okay, the member didn't complete it, you need this data, let's get them back in to complete it, right? So that you get all the right data downstream. And that's one example. The other example of moment of influence actually takes kind of the onus and the driver for taking action upstream and to the member, meaning once they fill out that question, the survey, and we know that this is an emotional kind of a vulnerable situation for the member to fill out these questions, and we've learned that from research as well. Okay, so we want to make sure that they feel listened to. So in that moment, you may have identified that yes, and this is going off of Sherry's examples, right? They maybe have some food insecurities, transportation issues, right? what do you do about it in the moment, right? You can serve up benefits that are tailored to finding food banks, to making sure they know that they have their transportation benefits. Maybe they have a heightened risk of falling. Maybe serve up some educational videos or sign them up for a care plan relative to reducing their risk of falling, right? But not waiting until the information gets downstream, showing them those resources, that information immediately following the HRA, so that members can take action on it, right, in that moment. And that's kind of where we are going. And we have a number of health plans that we are not only exploring these use cases with, but there's some that are more tailored that I probably will get to later on, that are actually trying to get members to do the things that are good for them, right, that the health plans want them to do and be proactive about their care.
Okay, so what I heard there is, first of all, we're gonna steal Humana's moment of influence phrase for the rest of this episode. So
Oh
we'll
yeah.
start there. And when we're thinking about the moment of influence, one, and that we're taking a page out of online retail is when someone abandons that shopping cart, you got 1 or 2 days at most to get them to execute, or it's highly unlikely they'll ever come back and purchase those items. And the same goes with the HRA. That's number one. And
Correct.
two, what I heard, and tell me if I'm missing anything else here, Jake, but I thought this was pretty telling, common sense, but really hard to execute, is there needs to be almost an empathetic strategy to get when you're conducting an HRA over the phone, and not just asking the question and logging the answer, but actually responding to people's answers right there. People want to be heard, and providing them guidance right there as a result of a particular answer to a particular question. Did I
Exactly.
get that all?
Exactly. Yep. Yeah.
And
Taking advantage of having their attention, right? Making the most of it.
do you have an example, maybe a health plan in action doing that and having particularly good results?
Not specific to the HRA at this point, but we do have other where we administer surveys to get members to go to their annual wellness visit, for example, right? And if they indicate that they have or that they're going to go to their annual wellness visit, making sure that we're not just saying, okay, thank you, but actually giving them the opportunity to schedule it if they haven't. And
Gotcha.
there's other components to that that I want to say for later, but it's an important aspect of just like, hey, we know that this member is going to go. Let's close the gap to getting them to their appointment, right? And actually make it for them.
Perfect. Uh, Sarah, I want to come back to you. There's a question from our listeners right now and watchers. Are you using conversational behavioral intelligence from the calls you were alluding to both measure wellness and effectiveness? Do you even know what that is, CBI?
It sounds very AI-ish. I would say our approach right now, it's a very human approach. And so using that data and what we know about our members to have that human-human call, and we currently are not analyzing anything afterwards.
Got it. Got it. And I guess a question for all three of you. I'll start with you, Sherry, because this is actually one that is pretty good. I never even thought about it. How do you know if the social disconnection, like loneliness, is impacting engagement and behavior? Like, how do you know if the social driver is actually negatively impacting a particular individual? I mean, I know holistically there's probably lots of data out there to suggest they're higher risk, but what are you using to measure if Eric Laser is not engaging or is at higher risk because he's lonely?
I think the important thing is looking at the outcomes. So, for example, when we kind of look, for example, for people with diabetes, for example, sometimes what happens is when we see folks with these social risk factors that may have some of these vulnerabilities, we see things like higher ER visits because maybe they don't have the right access to care through their transportation and they're not making it to get their medications filled. We may see more hospital admissions associated with those individuals. So it's very important to really understand kind of what's happening from an outcome perspective and where we can engage to maybe remove a barrier to care so that we can help them not have to go to the emergency room and get them maybe to their physician instead. So I think it's really important when you think about tracking these types of metrics that you have key performance indicators that you're looking at, because you can learn a lot. You know, you could go down one path, for example, with a group of individuals and see that it's not really improving your outcomes. And maybe you have to navigate a different way to remove that barrier. So I think that's extremely important as part of this is having those indicators that you're looking at and managing those outcomes.
Got it. And just a question for all of you. I'm guessing that HRA kind of execution is more of an omni-channel effort versus just phone, just email, just app, or is it one specific way or the other? Look, I'm sure are HRAs just being done by phone?
No, it's omni-channel for sure.
Mhm. Yeah, at Acario, we're taking we got to do a coordinated omni-channel approach across everything that we can do within, compliance reasons.
Let's talk about driving behavioral change. And as we do that, I want to, remember I mentioned that feedback form, get my notes, feedback. One of the things at the end of last year that was being requested of us is for the regulars that attend our webinars, why do we continuously have to register and provide you with the same information? So what we try to do is give you register 2 shows in advance for everyone if they want to come back every Thursday. So we have 2 upcoming shows on this sort of in this genre that we wanted to ask you if you wanted to attend. We have one next week on closing the member engagement gap with AI powered actions. And we've got an incredible group of panelists confirmed. If you're watching via Zoom, you see a picture of all of them. And we also have a show on the forecasting frontier and thinking about how AI is actually helping reshape risk, revenue, and ROI, not only just from an underwriting, but also from a pricing and customer acquisition standpoint. A lot of Medicare, Medicaid talk as well, and that will be on the 28th. Again, live at 12 o'clock East Coast time. Incredible group there that you see in front of you of industry leaders who are going to come on the show. So we'll register all of you attending live. I don't know what we do for our podcast listeners. I think you have to come to our website and just register, but maybe I'm wrong about that. Maybe there'll be a registration link in the show notes. Let's get, Sherry, I'm going to keep you on the hot seat. You've described how you gather data. Could you give an example of how the organization is applying that to improve engagement in a very measurable way, like a story?
Sure, I'll be glad to do that. And I would like to go back just real quickly to that conversational question, because I do think the other thing that's really important when you think about data collection is not everything has to be done, with a point and click or digitally or with a, filling out a survey. I think you can learn a lot in a conversation with an individual. So really being able to apply things like natural language processing to maybe get some nuggets out of that conversation that somebody may not even feel comfortable putting on a piece of paper, but they would feel comfortable talking to their care manager about that and really assessing that information. So I think that's an important data point when we think about unstructured data.
So
but back to
it wouldn't be like an ambient listening for customer service. It would be something like after the call to follow up with, is what you're suggesting?
Exactly. So to understand, and again, kind of back to what Jake was saying on those real-time moments, that is probably the best time to kind of react to if you hear something from an individual, is to be able to react at that moment. So, and teeing up some opportunities for, like, let's say a care manager or customer service rep. But kind of back to your question on, how we are leveraging this information. So when we think about, a lot of these data points, we are looking at things like a claims risk factor. We're looking at things like a social risk factor. We're looking at things like psychosocial, like how are people going to react when we give them an opportunity or ask them to do something. And so all of those components are really important when a care manager is maybe working with an individual, or if we're leveraging a digital outreach to an individual to make sure that we're addressing the right information. So a perfect example of this is a couple of things. One, when we send this information over to like our care managers, for example, we will tell them where the focus areas are. And so we have a tool where we're leveraging generative AI to help let's say a care manager prepare for a call, because usually it takes them a little bit of time to really understand what's going on with a member and where do they need to focus prior to getting on a call with that member. And so this tool allows them to go in and key you know, the member's ID or whatever, and then it will come back with pertinent information, like what are the key risk factors associated, you know, with this individual? What are some social things that they may be, that we may need to help them with? And it really helps them prepare and focus the call. And so we've gotten really good feedback from our care managers on leveraging this tool, because it's helped them to have a much more productive conversation as they engage with the member. We are starting to maybe look at how we can leverage some of that same information with some of our digital outreach. And then another area that's really important, and kind of back to what Jake was saying, is that sometimes, you know, members we may not be able to get them on the call, like Sarah was talking about. But you have a very captive audience when a member is calling in to ask a question about a benefit that they may have, or a question about a claim. So it's very important when you think about whole person management to equip, you know, your customer service representatives with information so that they can engage with that member. So for example, if a care manager has been trying to get in touch with that individual, you know, can we redirect them to them? If, for example, there is a gap in care, like someone needs to go have their preventive visit, you know, allowing that customer service rep to actually schedule that appointment for them right there on the phone. So you're closing that gap in care. So if we think about whole person management, what we have to make sure that happens is that there's an integrated approach across all touch points of that member, whether it be with a customer service agent, whether it be with a care manager, whether it be your digital platform. It's very important to integrate all of that so the experience is very similar no matter which channel that individual is going into. So leveraging data to understand all of that is really important as we start to launch that out to the various stakeholders across the organization who
Let me just quickly summarize. I'm sorry to interrupt. I want to quickly summarize this because this is gold. So we're using an AI tool to let your care managers have a much better understanding of a complex member situation through the data that you have. So it's not entirely different from the suggestion you suggested at the top, referencing back to the last question about almost providing some insights on how to word a follow-up question coming out of an HRA. This is a little bit different, but similar. We're enabling care managers to translate complex member data so that they could do more targeted outreach and make more empathetic and pragmatic suggestions when they get that member on the call.
That is correct. And I think, you know, back to the health risk assessment data and any of the other health assessment data that we may be leveraging, you know, with a care manager, when we think about this, you know, sometimes it will help us identify things that we knew nothing about. So, for example, a claim may not always tell you if a person's depressed, and that has a huge impact on their ability to move forward with a care plan. And we need to address that issue with that individual. They may tell you that in a health risk assessment, or they may tell you that in a conversation with a care manager. So that's why all of these data points are really important, because, you know, the member knows the member best, correct? And the more that we can attain and understand about that member and what they're telling us, the better engagement, you know, we're going to have with them, and the better improvement we're going to see on behalf of that member.
Great. Tap into that moment of influence even more. We should count a fun drinking game. How many times moment of influence is mentioned today? Last final quick follow-up, because I would be remiss. Like, what's the impact there? Have you been able to measure anything yet about how this new investment and approach is working?
Well, I think a lot of, you know, what we're focused on right now with some of these tools is, you know, how much it kind of is saving time for the care managers. But I think, you know, the quality of their calls has been much, much better. We really haven't had it in place long enough. I think it's been in place now for about 90 days, maybe 120 days. And we're just now starting to kind of look at the outcomes related to that. But we have seen a much bigger improvement with our care manager's ability to engage with that member, the conversations, but then also getting to more calls throughout the day and being able to engage with more members because they have this tool available to them at their fingertips.
Great. So it's saving time, though. We know that for sure. It's getting more efficient.
Yes.
Okay. Awesome. So Jake, I'm gonna shift over to you. And when you think about traditional risk models and how they miss the mark in understanding member behavior, like how does one fill those gaps and maybe provide us with an example of an organization that
Yeah.
that-
Yeah, and I honestly think Sherry touched on this a bit when talking about like learning more about the member using natural language processing. And I'm not going to say we use that today, but there's an example of trying to surface not just the clinical and social like factors that you can parse out of a survey, but really like what is the members' intention or the likelihood to actually take the actions that you want them to, right? In the example, kind of feeding off of the first question you asked is, we're working with an ACO to help them schedule appointments for annual wellness visits, right? And it's a pretty straightforward process, but it's like we ask them, are you going to do it, yes or no, or have you already done it, right? I already gave the example. If they say yes, we want to be able to say, okay, well, let's get you to schedule it, right? Ideally, they can go through and schedule it if they haven't already. But if they say no, we start to unpack what are the barriers or reasons they're not going to go do it, right? Assuming they haven't done it yet. And there's a very famous individual by the name of Corey Bussey who would say that the reasons that we would put on that screen or for the call center agent to serve up to the member to understand the barriers, it's finite and knowable. It's not a super complex list of things that we might want to parse out, but knowing what those barriers are and getting members to engage to understand them, and then serving up reasons or like tools or solutions for them to overcome those barriers, again, in the moment of influence, to get them to go and schedule their annual wellness visit. And this is what we're doing with, again, an ACO. It's a relatively new program. So I don't have a lot of results to report back yet, but it's the premise that we can get members to do things just by understanding their intention and helping them overcome the barriers that might be preventing them from doing what's best for their health.
Right. So that important of that real time in the moment context to supplement sort of, I don't know, we'll call it static risk scoring.
Yep,
Love it. By the way,
exactly.
Corey Bossy is the head of strategy at Cario, and he's only famous because he's been on the show 2 or 3 times. I've made him famous.
Yeah.
Hopefully he's listening and knows that. So coming back to Sarah Moyer, Sarah, so once you have those behavioral and social insights, how do you organize your teams and your processes to actually now move quality measures?
Yeah, so that all the data and insight, as Sherry mentioned, really helps people connect better like with the members. And so then if they haven't scheduled their mammogram and they've never thought about a mammogram, maybe they'll actually listen and do that. And so just love the ideas that are coming forward here and how we can make that process faster and quicker and have more insights from a bigger collaboration of a team. I oversee our utilization management, our case management, quality and health equity pop health teams. And so we've had great like integration and collaboration among all those, but just love hearing how you can also pull in the call center and other ways too with that. But with quality, I mean, I think the great thing about quality is because, as I mentioned earlier, there's such a huge incentive to really improve that care, not just for the members' health, but also financially. And when those line up together, it really allows for innovation and movement as well. And so just really cross-functional collaboration with integration between the entire company, monthly touch points, like even weekly, and some trust in the process too, that in order to improve for quality, like we have to improve 3% every year. And so you have to get better and better every year. So you can't stop innovating. And because the population also is so targeted that we're trying to influence, it just lets for the ability to do smaller pilots and to innovate quickly and pivot if need be. And so just allows us to have more fun and trying to improve the health of our members.
What are some examples of pilots, just so the group here could take some notes?
Yeah, I've been taking notes too in this call, but so like mailing home test kits to the house if they're interested, between opt-in and opt-out. We've tried going to the member's house and seeing if that would have better luck than trying to reach them on the phone. So many, different things with different results. And sometimes you don't see the result right away. It takes time. I think one that we're seeing a big impact is how we stratify our data by family unit, like not by measure, not by patient, but by the whole family. And so if we get them on the phone, we're talking about all their kids, their screenings, and that allows us to have a bigger impact as well.
And I'm guessing too early to share results, right? I don't know.
Yeah, too early to share. Some of them are kicking off this week, so yeah, don't have results back to share.
Okay, Sherry, I have a good follow-up for you, but before we do that, I'm recognizing we're a couple of minutes, potentially a couple of minutes behind. So I just wanted to let folks know again, we cannot do this show each and every week without incredible partners from across this country that are doing some cool things and offering bright spots to all of you. And I was telling you earlier about Acario. They're been one of our long-standing partners, and they are, if you haven't heard of them, you should check them out at cariohealth.com. But they are a platform that helps payers drive better outcomes through that personalization and data-driven outreach. And you can already hear it when you're hearing Jake's answers, how they integrate clinical, behavioral, and social data to identify the right members and to deliver those tailored messages at the right time. And they do it in a very holistic communication channel way, omni-channel way, through text, email, phone, mail, etc., based upon members' behaviors and their preferences. They have been able to see 30% increases in preventive care completions and a 20% reduction in missed appointments. They're a HEDIS gaps in care kind of secret weapon for folks. I highly encourage you check them out and maybe even reach out to them. They are great people just to pick their brain. And they combine really good technology with really good healthcare knowledge. And I've gotten to know them really well. And I wouldn't be putting my voice endorsing them if I didn't really trust who's behind all the tools and what they're doing. Incidentally, they are hosting a client summit called Moments of Influence, drink again, that takes place on October 21st, 22nd, and 23rd in Nashville. And this event is actually going to explore how AI is transforming how health plans are engaging. So a deep dive, and they're going to have like the former, yeah, you probably know Anish Chopra, who I've had the pleasure of having dinner with a few times. He's the former U.S. Chief Technology Officer. They also have Rex Wallace and Nate Lucina talking about star ratings, and they've got discussions on Medicaid MCO legislation, and all kinds of discussions on self-reported member data plan, leaders at Kaiser, AmeriHealth, Humana, Medica, Horizon, and Engages. It's going to be a great event. And if you are at a health plan, there's 6 spots where they're offering complimentary registration at a health plan. And you want to see this agenda, we're going to ask, well, I'll send it to you. So why don't we put up a poll? And if you want to get some more information about this event, again, it's for health plans. Apologize, you could probably recognize why. If you're a solution provider in the audience, no need to look at the poll, but we will send you that information, and you may be able to take advantage of one of those 6 spots so you can head out to Nashville, have a good time. They put on a fun, informative event. Highly encourage you guys check it out. So Sherry, I want to move over to you, and we were just talking about quality. We had Dr. Moyer talking about quality, and the pilots are running. How are you equipping at Tennessee providers with the social and clinical insights they need to address members more holistically? How are you helping them do a better job?
Yeah, and I think that's really important. The provider-patient relationship. The members. They're going to trust their provider's guidance, and so it's really important for us as a health plan to come behind the provider and support the information that they need to help manage that patient. And so one of the ways that we do that. So when you look at a lot of these more chronic individuals, they have multiple providers that they're working with, whether that be a primary care physician, whether that be an endocrinologist. And a lot of those providers are, making decisions and helping the member navigate their particular disease state. The primary care physician is kind of the gatekeeper with all of that. So helping the primary care physician really understand what all is going on with that member, what other medications are being prescribed, whether they are adherent to that medication is going to be really important. So one of the ways that we do that is we have what we call a quality care rewards portal that our providers can come into, the ones that are working with us on our value-based care initiatives, and they can come in and see the whole person and understand a couple of different things. One is, their utilization stats. Have they recently been to the ER? And there are some alerts that we also give the physicians, like if one of their patients has just come out of the ER. So there's some real-time alerts that we're doing. They can also see their patient population and what kind of gaps in care they see with that population and where there's an opportunity to close that. They can see all the medications that they're taking and whether they're adherent to those medications. So again, as the patient comes into their office, they have that opportunity to address any of these issues. The other thing is that we also do is we also make visible to these providers those social risk factors. And not always can a provider, always address those particular vulnerabilities, but we are also coming behind the provider with a collaborative approach to maybe close some of those social gaps that we see, like transportation, for example, or a language barrier, et cetera. So it's really important to have the provider in the loop as we think about member engagement and how do we help that member navigate the healthcare journey, and making sure that the provider is fully aware of what's going on with those particular members in their population.
I need to quickly unpack this and ask you some follow-ups. So it's a quality care rewards portal. It's a provider-facing portal.
Yes.
That provides incentives to providers. They get real-time alerts from it. They get gaps in care information. And then
Yes.
using the word dashboard. I'm going to use it. Tell me if it's misrepresentative of what you mean. A medication dashboard for each member and a social risk factor dashboard for each of their members. Did I outline that pretty well?
Yes.
Okay. Remember, people are going to take the survey because of my great notes. I want to make sure I got it. But what I really, how do you get a busy doctor in Tennessee that, probably just got acclimated with Epic or whatever they're on? They've got all kinds of other health plans bothering them with stuff. How do you get them to log in to Blue Cross Blue Shield of Tennessee's quality care rewards portal and not blow a gasket?
Yeah, a lot of the time it may not be the actual provider. It could be someone in their office that is going into that portal and pulling information prior to maybe a patient visit. So there's a lot of different ways. We do get a lot of engagement with the portal. We have a lot of, every single one of the provider offices that have access to it are engaging with that portal. And so we've seen a lot of uptick in that, and we've seen a lot of improvement in the ability to close gaps in care when we look at providers who are leveraging the portal, who are also sharing information with us through our clinical data exchange. We've seen huge improvements in their ability to actually close some of the gaps in care for their patients, and we're seeing some really great performance and some outcomes when we think about people going into the ER, et cetera. Those are, we're seeing improvements in that area as well.
Right. Love it. So we got about 15, 17 minutes left. By the way, our producer, Nicole Roberts, just posted that survey in the chat. If you're watching live, you can take it right now. And it's coming to your email too, 2 minutes. So Sarah, let's come back to Humana. Let's kind of start beginning to bring things together. If you could hand everyone listening today a blueprint for building trust-based outreach, what are the essential ingredients that have been working at Humana?
Number one thing is our associates. They've got to have heart. They've got to be committed to the members. We talk all the time, like if you hang up the call and that is how you would have treated your own sister, your own mother, then you did a great job. And so how do you operationalize that? Yeah. What were you saying? Sorry.
I just said great people, right?
Right. Great people.
You
can teach them the healthcare pieces. You can teach them the protocols, but they've got to have that heart and that desire to really try to connect with people and improve their health.
Anything else? Was that the only thing in the blueprint?
I think that's the main thing. But then I think using the data too, like having that background before they make the call so they can build trust quickly. And then the follow-up. The follow-up is probably the most important, right? If you said you're going to connect them to a food resource, making sure they actually get that, calling and checking on them to see if they went to their appointment that you helped them schedule. So whatever it might be, however big or small, just that reconnecting builds that trust and then builds that relationship going forward. So they're more likely to answer the phone next time they see Humana call. And that momentum builds going forward.
So Well, one of the things I thought was pretty interesting when we were kind of prepping together was also, and I don't know if this is meant to be in the blueprint or not, but about how you have your team and those all-stars sharing success stories, and then what kind of like metrics do you share amongst the group for like we'll call it just competitiveness for everyone, and then any rewards that you have in there tied to whatever you're tracking, whether it be calls per week and call to action, whatever you're tracking. I mean, how important is that?
I think I hear over and over again that like connection to the big outcome is so important. Like they see us hitting that metric that drives the work that they do. We track the number of calls that they make and then the number of connections and appointments actually scheduled and then ones that follow up. And so we care more about who they're able to reach and then what they're able to do with that number when they reach them than the number of calls they make per day. So that's really important. And then the success stories, sharing that. I think a huge thing in healthcare in general is just that burnout. It's hard. This work's hard. And so just getting back to the basics and why they joined in the first place, what motivates them, and get that heart back into the center of all their phone calls is important.
So Jake, we've had Sarah talking about collaboration amongst the executive team, hiring the right people to be reaching out to the members. Sherry's been talking about collaboration. When you leverage the members' voice in engagement and adherence campaigns, like what changes have you guys been able to see with the plans that you've been working with?
I mean, well, the plans come to us in the first place to move the needle on a specific metric, right? I mean, if it's just filling out HRAs, if it's closing gaps in care, et cetera. So, I mean, the proof's in the pudding, right? If we're able to move the members to do what the health plans want them to, then the approach we're taking around messaging, moment of influence, et cetera, is working, right? But in order to get to that point, we obviously have to work on the side, do user testing, et cetera, so that plans have confidence that what we're doing actually is going to work, right? So we're not making things up as we go. I hope that answers your question, but it really is a matter of the plans come to us for a reason, and they stay with us because we're able to continue doing that, closing gaps in care, filling out health risk assessments, et cetera.
Could you give me an example, like a pharmacy example or a medication adherence example?
Yeah, so there's a large national health plan that we're working with to well their goal is obviously close gaps in care, drive member retention, and obviously improve their top line, right? And all that through signing members up through mail order pharmacy, right? So similar to some of the examples I gave before, we are working with the plan to engage a subset of members, and this is actually in a pilot similar to what Sarah referenced, right? To understand what is their current pain point around retail pharmacy, what are some of the barriers that they have to just getting medications in general, and then obviously learning about them and serving up a means to either learn more about or to sign up for mail order pharmacy with the health plan. And that's just an example of us understanding what the members are looking for, and then leveraging moment of influence to get them to do something that the plans are wanting them to do.
And so outcomes higher probably conversion on the mail orders, improved adherence in general because of that.
Yep, that's the idea, and we're dependent upon the health plan to let us know how that is going. But through the process, we're already learning that, about two-thirds of members have frustrations with retail pharmacy. About a third of them aren't even aware that mail order is an option for them, right, through the health plan. So the data that we're uncovering is also informative, let alone like the outcomes and the moving the needle on subscribing to mail order pharmacy.
And it's got to probably help, with AAP, right? When we're talking
Of
about,
course. Yeah. I mean, it's obviously it creates stickiness, right? If the members all of a sudden are used to and relying upon the mail order pharmacy that they have now that they would otherwise potentially lose or have to sign up for again in another plan.
uh, real quick, folks. I mentioned at the onset, like our organization, what we do every day is create content like the show, and we're also really busy building communities through these. What we've been doing is a lot of small, private programming where we have group discussions. Imagine like 6 or 8 of you on a call with me and maybe one of my Bright Spots colleagues having a group discussion. And we're having 2 of these coming up that I wanted to put everyone's radar. If you want to register, we'll register you. These are 4 health plans. On September 17th, we're talking about how Precision pays and how Smarter RA fuels MA plan growth and sustainability. So if you're at an MA plan or you're in charge of that, we just talked about annual enrollment, it could be a really good discussion. We usually get 6 to 8. So if we get a little bit bigger than that, we'll do breakout rooms, and we get a really high level individuals to come to these events. And then on September 24th, we're running one on engagement, and we're covering sort of how health plans are converting behavioral data to stars and satisfaction. So really related to today's topic, big time. So if you want to come to one or both of those, we'll put a poll up and have you guys join that. Speaking of converting behavioral data to stars and satisfaction, Sarah, how is Humana finding and acting on behavioral or social insights that traditional models maybe tend to miss?
Good question. I think just going back to using that to really build that connection first and looking at combining it all, like where the person lives, because we know that our zip code influence health more than any other piece. And helping that steer the conversation that we're then having with the members. And so it's like meeting them where they are, being a chameleon, helping them get what they need, and then that drives then towards better health and making health more important.
Right. I was just told my camera was off. I don't know how long it happened, but I apologize for that. Sorry. I know
I think just if I could add on to that, I think one of the important things when we think about behavioral and social, you had asked the question previously about, how do you make sure that you're not bombarding, members with all of this information and what's the right thing? I think the important thing when we think about data points and understanding how members react to our engagement strategies, looking at information like how are they leveraging our website? How are they leveraging our app? Are they interacting with certain content that's meaningful to them? And then also, if we've done previous campaigns or previous outreach, what was the outcome with that member? Did they interact? And so what that really tells us is that the focus and the way that we may be engaging with that member may need to change because maybe it hasn't been successful. And so that's really important when you think about those behavioral and social factors and really meeting the member where they are.
good stuff. Jake, as we're coming to a close here, I have a couple of last questions I want to ask the group. I want to come back to you first. What happens when the member responses are shared back in real time with the plan? What are you able to do there? Maybe have an example if you have one.
Yeah. I'm ecstatic when we have health plans that actually can leverage real-time data, right? And that's something that means from a product perspective, that means they have a problem to solve that our data can help answer. Um, Uh, a lot of times today we have some health plans that are using it to just apply risk scores to their health risk assessments. They have, again, sharing the data via Fire APIs downstream for care plans. And this isn't new. This is what's been discussed already, right? And those are some of like the more fundamental, let's say, basic use cases around sharing real-time data back with health plans. But I think where it gets more interesting is when we're not yet doing that because the health plans aren't ready. And we have a number, including like what I just talked about with the mail order pharmacy example, where we surface the insights for them, right? And if there comes a time when the insights that we are generating become of value, and this can even apply to the annual wellness visit, right? Example that I gave. When it becomes of value to them and they're ready to absorb that information into their downstream processes, great, we're ready. But until that need arises and the health plans come to us with that problem, like we're not going to force on them to do real-time data exchange, right? But we want to be able to serve the insights that we're discovering so that they can figure out if it's relevant to their processes, if that makes sense.
It does. It does. Sherry, I want to come back to you with the few minutes we have left. About a year ago, you were on the show, did such a good job, we asked you back. And you spoke about using clinical and social risk scores as part of your outreach and engagement strategy. And I'm just wondering if you could provide us with an update on where you are with that and what's next.
Yeah, I think, this is embedded and integrated in pretty much everything that we do. I mean, as I talked about earlier, we're teeing this information up to multiple stakeholders, whether that be our clinical team, whether that be our customer service team, whether that be the provider. I think our next step with this is kind of back to some of what Jake is saying, is how do we make this stuff a little bit more real time, so that as we are engaging with a member, on the phone or in a digital channel, that we can tee up this information at the point of need. And same thing with the provider. When we think about interoperability and how do we engage with their electronic medical records, and how do we exchange this data in more real time, I think that those are some of the areas that we are focusing on and trying to get it more at the point of need, and when we are actually engaging with the member, because sometimes a lot of this is kind of after the fact and you're kind of going back. So the more that we can address these needs at the moment that the member is engaging with us, the more likely we are to be successful in helping them navigate the journey more effectively, and removing some of those barriers and providing that peace of mind to them that we are trying to administer, and that trust factor that Sarah was talking about.
Great way to put a bow on this. I think this was awesome. Great discussion. Hopefully we get you guys to come to our follow-up private roundtable at the end of September. I want to thank you all for the time you've taken to prep with me and be on the show today in the middle of a busy week. I really, really appreciate it. And I want to thank everyone who's watching and listening for tuning in. We do not take the time you spend with us for granted, and we work really hard to make sure this hour is as useful for you as it possibly can, no matter if you're watching us live or you're listening to us at an airport or on the weekend time. And we know that hour can be used doing something else, and we want to make sure that it's valuable to you. And we hope the ideas and insights from today's discussion are able to inspire your thinking and enhance just your overall approach to improving healthcare for all of us. Shout out to our producer today, Nicole Roberts. Thank you for a job. Really well done. We all produce this show for you. And remember, this is your Bright Spots in Healthcare podcast. Take care, everyone.